Hello and welcome back to GP Video Podcast by Nadia. So today's question is, or today's topic is, do men also experience menopause or not? The answer is yes. I would like to start with telling you about my patient whom I saw in the practice. Um, Generally a very well healthy male human being, 48 years of age, came to me with the complaint of hot flushes. We can use both of them for that. So I did the entire blood test panel, blood pressure normal, medical history normal, on no medications, um, and weight, BMI, body mass index normal, temperature normal, body temperature normal. I did the whole heaps of blood tests, like vitamin D normal, B12 normal, iron normal, thyroid normal, full blood count, liver function, kidney function, everything on point. Um, and everything was all good. And so I also did then his testosterone levels, and surprise surprise, his free testosterone levels were quite low according to the range. So then I was like, okay, 48 years of age, low testosterone levels, everything else perfect, no other abnormality, no significant medical history, or no medications, experiencing significant hot flushes or flashes, and some mood up and down symptoms as well. So, is this male menopause? And I started looking into it, and yes, that is something like male menopause or andropause. So, I'm going to quickly discuss with you a few lines about what it is and how it can be treated. It goes without saying that I did give him some testosterone gel, and that really helped him with the hot flushes, and he's a happy man now. So let's just read about it. While the term menopause is typically associated with women, men can experience a gradual hormonal decline, often referred to as andropause or male menopause. Unlike the abrupt hormonal changes women face during menopause, which usually occurs in their late 40s to early 50s, which is around the typical age is 45 to 55, but it, as I've told you lots and lots of times, that it can happen anytime after 40. And some women also experience early menopause, because of the premature ovarian failure even before 40. So yes, 45 to 55, or let's say 40 to 55. So unlike the abrupt hormonal changes that happen in women around the ages of 40 to 55, men experience a more gradual decrease in testosterone levels, typically starting around the age of 30 and continuing throughout their lives. This decline can lead to various symptoms, including fatigue. Fatigue is also a very common symptom, reduced libido, mood swings, hot flushes, and difficulties with concentration. Almost all these symptoms that women experience. However, it's important to note that not all men will experience significant symptoms, and the severity can widely vary from person to person. Again, as opposed to women, like majority of the women experience symptoms, but in men that's not the case, because there is very gradual decline, while in women there is an abrupt decline, and that's why most of the women experience symptoms. The concept of andropause emphasizes the need for awareness and understanding of men's health as they age. Just as women seek support and information during menopause, men should also feel empowered to discuss their health changes with healthcare professionals. Lifestyle factors such as diet, exercise, and stress management can play a significant role in managing symptoms associated with this hormonal decline. By recognizing that men can experience their own version of hormonal changes, we can foster a more inclusive conversation about aging and health, encouraging men to seek help when needed and prioritize their well-being too. So yes, men can also experience menopause, and their treatment also, apart from diet and lifestyle factors and physical activity, is testosterone. So testosterone basically does not come in the form of tablets. It usually comes in form of gel or cream or injections. Testosterone injections are quite painful, so they are usually reserved for the conditions like associated with testicular cancer and stuff. But usually creams and gel are very handy to use and can be used, and they also work as estrogen gel and estrogen supplements, and they would also work on the symptoms that men have, like mood swings, difficulty concentration, hot flushes, and all the other symptoms, that fatigue especially. So yes, men also menopause.